Hello, Sandra Wharton, Infection Prevention and Control Consultant, Western New South Wales Local Health District. Well, back in the late 80s, early 90s, when I was working at the Royal Hospital for Women in Paddington, I did some holiday relief in infection prevention and control and enjoyed that stint, so went on to undertake further study by doing the Sydney Hospital Infection Control course back in the day to try and further my knowledge. And today, I'm still a practicing infection prevention and control nurse.
In some ways, I think infection prevention and control chose me. Having worked in many specialty areas and fields over the years, an opportunity came up to do a secondment and work in infection control, and I had no idea. But it's an amazing job. Covers everywhere. It's clinical, it's patients, it's science, it's micro, it's forensics, it's everything. And I couldn't believe that nothing is the same. Every day is different. It's a challenge, it's enjoyable, it makes a difference whether working with patients, working with staff, family. It's really rewarding, it's really challenging, it's all encompassing, covers everywhere, as I said, like whether we're looking at building infrastructure, water systems, building products. It's just an amazing job, and I can't believe that more people don't know about it and wouldn't want to work in the area. It's an amazing place, amazing space.
My name is Cecilia. I'm one of the clinical nurse consultants at Liverpool Hospital's infection prevention. I've always had an interest in infection prevention and control whilst working out on the wards, and a secondment came up in the infection prevention unit and I jumped at the chance to join. I quickly found out that infection prevention and control was more than just hand hygiene audits. We are responsible for so much more. Our work impacts patient outcomes and staff safety.
I started working as a registered nurse in 2005 in paediatric oncology and surgical nursing. And taking care of children with oncological conditions, you have to be very aware about infection control. Literally, failure to take care of them properly, with failure to not do your hand hygiene and provide good infection control, is a life and death decision for these children. I had fabulous mentors who trained me very well in this, in infection control, and it just became a passion of mine. It expanded even more when a colleague that I went to university with was working with infection prevention, and he provided me with the opportunity to do some leave relief with the service, and I started to do that, and I just found it more and more interesting all the time. The knowledge that I learnt while I was doing the reliefs, I took back to the ward, and I worked as a link nurse on the ward, making sure that I always had hand hygiene gel available for all the staff, educated the parents about how important it was, educated the children, made sure that our ward was a nice, safe environment all the time to care for our children and provide them with the safest place we possibly could.
Hey everyone, so my name's Brad McEntee and I'm in Infection Prevention and Control CNC at St George Hospital in Sydney, and I'm going to talk a little bit about why I chose to work in infection control and why I think other people should work in infection control. So I guess for myself, being completely honest, working in infection control wasn't really on my agenda as being a kind of nursing specialty that I would choose. But a secondment opportunity became available, and when I started working in infection control, I developed a burning passion for it and I really fell in love with it. So that was 6 years ago, and I am really proud to be working within this specialty. So some of the things that kind of I feel I was drawn to wanting to do was, or the things that really stood out for me within infection control, are that it's a patient safety position and it's very dynamic. So within our position, there are so many layers to it, and what I've really enjoyed is kind of pulling that apart and looking at what has worked really well in the past and what hasn't worked, and how can we be innovative and look at building on those existing principles to kind of improve infection control practices. within all of those layers as well is one of the big parts of our job is the human behaviour factor, and that's something that is also really interesting for me. Is a lot of the time our clinicians think that infection control is very basic, and we'll often think that they're completely across it, and some of the principles might be basic, but I think that when we look at that, we know that sometimes those basic things aren't done very well. So what I've really enjoyed is kind of factoring that into our infection control program and getting out there and working with people. So making sure that we have a good presence across the hospital and making sure that our clinicians recognise us, know our faces, know that we're approachable, and also, really looking at those human behaviour type elements and working with people to try to improve our practices on the ground.
Why would other people want to work in infection control? Well, you'd be mad if you didn't. It's everything. Often refer to it as the CSI of nursing. We're always investigating, looking for better ways, looking for safer ways, trying to find the seam of the crime, and it's just a really different space if you're curious, interested, want a challenge, willing to spread yourself across all areas, be open-minded and listen, and have an opportunity to make a difference and have a say, contribute and work with all different, nursing, doctors, allied, building, scientists, everybody. It's an amazing job that I don't think you would often know about because it's a very small specialty. We'd love to grow it to get so many other people on board, but there's more to come. And we need more people at infection control. It's a great job.
Why I think other people should come and work in infection prevention and control. It's an ever-changing environment and no 2 days are the same. You'll learn new skills and build on knowledge every single day. If you have even the smallest interest, I recommend that you come and have a go.
I think the main thing that really stands out for me is the infection control network. Other colleagues of mine who work in different specialties are often very isolated, and in terms of specialist support, there's not that kind of network out there. But the thing that I really love about infection control is across our hospitals, we have a very good network at a local level. So it's really fantastic that I can pick up the phone and call someone at another hospital in infection control in my district and bounce ideas off of them. But we also have the CEC infection control network as well, which is very, very unique and well supported model. So within that network, there's hundreds of infection control people where we can kind of bounce ideas off of, learn from them and their stories, and also it's a really good well supported network through having the infection control kind of leads at the CEC who are really passionate about supporting us and hearing our ideas as well, and bringing us along for the journey to look at the kind of policies and to have an opportunity to kind of make a difference in terms of the direction of infection control. I think another reason why others should work in infection control, I think if you're someone who's very curious, it's a really good opportunity to try something different and to kind of learn about some of the day-to-day activities that we do in infection control. So it could be then that you find a passion where you end up staying in the profession long term, which will be really great. But I think as well for staff, we've got some staff who often will come and do some secondments, and they really like that flexibility of coming in every so often and doing some stints with us. And I think what's really good about that is then we're upskilling the workforce to be able to go out there and kind of embed really good infection control practices within their areas. But the main reason I think others should come and work in infection control is that curiosity, really good learning opportunity, and it's a really fantastic network to be a part of. Thank you.
It's an incredibly interesting job to work in. There is so much diversity in what you do and what you need to learn. For example, recently during the COVID-19 pandemic, I needed to learn all about air handling systems and how airborne isolates, how the air handling systems change the way that the airborne droplets can be moved around. It's incredibly empowering. You get the opportunity to work with other staff members in a multidisciplinary team, get to ensure that you provide a safe environment, get to do lots of education. I love doing education. I love getting the opportunity to talk to patients and explain to them about the importance of what we do and how we do it. And I really love working with staff, particularly junior staff. I really feel like the most important part of it is if the staff understand why we say you need to do this, then their practice will change. And I love the fact that I can do that I can influence the practice of other staff so they can provide the safest environment to patients coming into our facilities. And obviously as well, I get to do lots of continuous learning. Infection control is an ever-evolving environment. There's always more research coming out. There's more new isolates. So example, like when COVID-19 happened, we all had to learn pretty quickly about how to deal with that novel virus. There's lots of technologies coming in, so more and pieces of equipment always coming in, so we're always needing to get up to date with how that equipment works, how it needs to be cleaned, so we can make sure that the hospital's aware of these things and we can assist making policies so that we can make sure we, again, provide a safe environment for our patients. It's a real problem-solving job, so you get presented with problems every day and you sit there every day and think, well, how can I sort this problem? How can I change the way this is happening so that I can make things better? Get to do lots of quality improvement activities. So I was recently just involved in a really good quality improvement activity in my facility. You get to be a detective, you get to investigate why patients are getting infections. You get to have a look in all the little nooks and crannies in the hospital to see if there's anything there that we should be worried about or that needs fixing. It's really interesting. You get to see a lot of stuff that you don't get to see when you're normally on the floor.
Well, we are so much more than hand hygiene auditors. We are a supportive service for all facilities. It's a dynamic and evolving field, constantly changing, requires ongoing learning and adaptation, which is very stimulating. Your collaboration with others and across many disciplines is also very rewarding. Your leadership and mentoring plays a big role, with the main aim for keeping patients and healthcare workers safe. If you want to make a difference, empowering staff and patients with knowledge to prevent the spread of infection, then I'd highly recommend choosing infection prevention and control.